Imagine lying on a stone slab, the sun beating down, no anesthesia, no sterile theater, just a shaman with a sharp obsidian blade about to cut into your skull. This isn't a horror film. It was reality for thousands across the ancient world. People willingly underwent brain surgery, and many survived. This is the story of trepanation, a procedure that rewrites the history of surgery. Ancient people operated on the brain with surprising skill long before modern medicine. Skulls from Siberia to the Andes show evidence carefully cut holes, signs of healing, and even multiple surgeries on the same person. These weren't desperate, brutal acts, they were calculated, skilled interventions. Some patients lived for years, even decades, after their operations. How did they manage pain, bleeding, and infection? And why did they do it? The answers reveal a blend of medicine ritual and the universal human urge to heal. As a neurosurgeon, I've held these ancient skulls, traced the smooth edges of healed bone. It's humbling connecting us to surgeons and patients from millennia ago. The drive to heal is not new. It's an ancient calling. These early pioneers remind us that ingenuity and resilience are timeless. Their story is a dramatic chapter in medicine's history, still being uncovered one skull at a time. The evidence challenges our assumptions about ancient knowledge. They dared to operate on the brain, the most complex organ with nothing but stone and courage. And they often succeeded. Trepanation, drilling or cutting a hole in the skull, is one of humanity's oldest surgeries, dating back at least 7,000 years. It was practiced worldwide: Europe, Asia, Africa, the Americas. Techniques varied: scraping, grooving, drilling, but all required precision. One slip could be fatal, yet many skulls show remarkable healing. Why did so many cultures attempt this? The most direct reason: to treat head trauma. In a world of violence, trepanation relieved pressure from skull fractures or removed bone fragments. Sometimes it was used for chronic headaches, epilepsy, or to release evil spirits, where medicine and magic intertwined. The surgeon was both healer and spiritual guide, opening a doorway to restore balance. This was not primitive, but a sophisticated response to suffering. The global spread of trepanation shows a shared human quest to heal the mind and body. Nowhere was trepanation more advanced than in ancient Peru. Over 1,000 years, Andean cultures performed thousands of these surgeries, refining their techniques across generations. Early skulls show rough attempts, but later ones reveal clean incisions and high survival rates. Incan surgeons, at their peak, achieved survival rates of 75 to 83%, astonishing for an era without antibiotics or modern anesthesia. The evidence is in the bone's smooth, healed edges show patients lived long after surgery. Some even underwent multiple procedures. Compared to the American Civil War, where similar surgeries had less than 50% survival, the Incas were twice as successful. Their mastery was built on observation, experience, and a deep understanding of anatomy. This was not butchery, it was a true medical tradition. The Peruvian story is a testament to the heights ancient medicine could reach. How did Peruvian surgeons achieve such success? Their tools were anything but crude. Obsidian knives sharper than steel, bronze tumis, chisels, and gouges. They likely used coca leaves as local anesthetic and chicha beer for sedation. Post-op care was crucial. Herbal antiseptics, boiled bandages, and clean environments helped prevent infection. The result? Skulls with multiple healed trepanations, proof of survival and trust in their surgeons. Trepanation was a respected, viable intervention, not a last resort. Their practical knowledge, honed over centuries, saved lives. The evidence is undeniable. These were medical successes. Ancient Peruvians placed immense faith in their healers, and that faith was often rewarded. Across the world, ancient India produced another surgical giant, Sushruta. Living around 600 BC, Sushruta authored the Sushruta Samhita, a surgical encyclopedia detailing over 300 procedures and 120 instruments. His text described pre- and post-operative care, wound management, and advanced techniques like rhinoplasty using forehead flaps, a method still used today. Sushruta also addressed cranial surgery, treating skull fractures, removing bone fragments, and relieving pressure. He stressed cleanliness, sterilizing instruments in fire, and systematic observation. Unlike Peru, Sushruta's legacy is written. He taught students to practice incisions on gourds and suturing on leather. His approach was scientific, evidence-based, and centuries ahead of its time. Sushruta's teachings reveal a formal system of medical education. He demanded courage, steady hands, and sharp tools from his students. His work stands as a bridge between ancient and modern surgery. Sushruta was not just a practitioner, he was a scientist and teacher. His influence echoes through the ages. The success of ancient surgeons challenges our modern arrogance. We imagine medicine as a straight line of progress, but Incan survival rates outperformed Civil War surgeons with better tools and drugs. The difference? Infection control. Civil War doctors, ignorant of germs, spread deadly infections. Incas, through empirical practice, kept wounds cleaner. Their anatomical knowledge, like avoiding major arteries, came from observation, not textbooks. Modern doctors are often awed by this ancient expertise. It's a lesson in humility. Effective medicine can arise from careful observation, not just theory. Ancient surgeons adapted, learned, and succeeded. Their story reminds us that knowledge takes many forms. We shouldn't dismiss the wisdom of the past. The story of ancient brain surgery leaves us with wonder and questions. What secrets of anesthesia and antiseptics have we lost? What other complex procedures vanished without a trace? These surgeons were not primitive. They were skilled, observant, and courageous. Their results rivaled those of much later eras. The greatest lesson is humility, to observe, to learn, and to respect the ingenuity of our ancestors. Their plant-based medicines hint at untapped pharmacological knowledge. The silent skulls in museums speak of pain, healing, and human ingenuity. The quest to heal is ancient, and its echoes still shape us today.